those that are here in the room and online are very welcome to what I hope is a really pragmatic and interesting workshop here. My name is David Humphreys. I head up our health policy practice at the Economist Impact, which is our policy think tank and global audience engagement element of the Economist Group. And I'm delighted to actually talk about a piece of interesting work talking about toolkits in pandemic response. For those that may have seen the prior session, responding to pandemics are terribly difficult, and understanding what works and what doesn't is really very critical, and leveraging the results of a piece of research that we've just launched today. We're going to give you a bit of snapshot what it looks at, and then make sure that we can talk about it and make sure people understand its impact and applicability to the reality of most any country around the world. With that said, I want to go ahead and move into the slides. I think we have one of my colleagues, Ellie Vaughn, who is online right now, that we can move through into the agenda slide. There we go. And so the objective we have here is really to look at what countries you can do to respond to the pandemic now and in the future. We're going to give you a quick overview of that research. The research is publicly available. I want to thank the folks from Sanofi and their support for this engagement and journey that we've gone starting from the beginning of the year to understand those lessons. You're going to see a bit of the work that went into it, the results in terms of the measures, and particularly the toolkit and how rich this is, both in actions, the involvement of stakeholders, and those exemplary policies and applicability of countries from around the world. Then we'll look towards the future and a pandemic response toolkit and how that applies, and use that as part of our panel conversation that we will have here today. Before we get into that, I do want to give you just a brief overview of the work that will set the stage for our conversation here. Do note as we go along, we're going to actually engage all of you through a poll question or two, test out the technology and get your perspective, because part of our goal with this work is to make sure people really understand how applicable it is. We're going to have some wonderful experts from around the world talk about their perspective. We want to get yours. And so for those that are watching virtually, you'll see those questions here shortly, and we'll refer to them and balance that out with the toolkit and the experience that we have for the panel. But let's go ahead and jump straight into the work here. And as the title, as you can see there, Country Level Pandemic Response Toolkit, Enabling Lessons Learned. Our goal really was try to understand those lessons, the tools and levers that made a difference, from building up evidence-based policies to mobilizing resources to building trust within populations and ultimately generating the best possible outcomes in a very difficult time. And we want to be able to explain what goes into that toolkit, the exemplary policies, how that link back to countries, and recognizing we're still in the process of an ongoing pandemic and making sure that's applicable today, as well as applicable going into the future and preparing for future pandemics, big or small, that may come through. If we move into the next slide here, just a brief word on the methodology. We started with this journey and the hypothesis that a series of countries, 5 that we started with, had elements what we call best practices. And we wanted to be able to understand what those best practices look from. That came from the Asian markets and their response, mobilizing resources in countries like here in Germany, and looking even at elements in the rollout of vaccine in countries like the US. Leveraging that experience and research, engaging wonderful experts, 2 of which we have participating in today's panel. We were able to take them, that framework, and really revise it and try to make it real world focused, meaning we could apply it to any country within the world. Based on that feedback, going out and doing additional country research, I think 7 countries that we covered, to round out that point of view. And again, going back to the advisory board to make sure that toolkit that we come up with is really implementable, that people could see a roadmap, not one size fits all, but a roadmap of actionable policies based on real world cases. That is very detailed within the piece of work. And so it is something, again, you'll have a chance to see the link a little bit later on and hopefully jump into the toolkit itself. Let's go into some of the top level results. Here, what you see on the right-hand side are 8 mechanisms that we identified for effective pandemic response. So that is evidence-based approaches based on past experiences, a lot of the lessons from past outbreaks in countries like Taiwan and South Korea, linking those policies, the best possible evidence in the case of New Zealand, to the deployment of resources and redeploying that as leveraging the laboratory network here in Germany and using that in a way that's impactful, in this case for diagnostic testing, and the concept of trust, which we know was really very critical in the conversations and communications that happen in a country like Denmark. Of course, there were equally important lessons of things that were not done that we also applied through this work, because no country had a perfect response to the pandemic, given how difficult it was to understand the levers that were available. All these served as the themes for our country toolkit, which we will see on the next slide. So in this next slide, you see this is broken out into two different segments: national response, evidence-based, capacity issues, coordination, and national contribution to the international response. Within the toolkit itself, you will see different activities, I think numbering almost 28 in total, that link both the activity, the strategic actions, and the stakeholders that are involved in coordinated disease monitoring, ensuring equitable access, single source of trusted information and consistent messaging. That is really very critical. And so there's multiple examples that we have seen in countries that have been able to respond, and that's part of the value that we want to lay out the roadmap of how countries actually put this into practice. It's the single biggest question that we get in our work in those best practices: how are they actually implemented from the beginning to end? And a lot of the different stakeholder voices, for good or for bad, that are involved in that process and laying out that roadmap is really very critical. And if you go into the next slide, you'll see some of those examples of how this breaks out. Then on the top graph for every country we covered, mapped out what did that country response look like? How does it compare in terms of number of cases that you see month over month? And for the countries that we covered later, the rollout of the vaccines. The whole point is to start to make some linkage between elements of this response, the exemplary policies, and the impact that they have, and that transcribing into the full toolkit that people are able to leverage both the actions, who are the stakeholders involved, if it's international organizations work with national counterparts and coordinating what does evidence-based practice look like, and then maybe even engaging the level of communities in different elements that are involved in that stakeholder work being really very critical. No single element of the toolkit is meant to operate in an island. It is meant to be rather interrelated. It's also not meant to be a cookie cutter approach and applying to all countries and all circumstances. They face different and unique environments, which we will hear from our experts very, very shortly. And so with that very quick review, I promise you'll have a chance to dive into the work a bit later on, but I really want to pivot into the panel conversation. As we do that, I believe, and we'll count our wishes that the first, this is the lessons that we have here. Let's go ahead and jump directly into the poll question. So this is our first poll question. What can we positively learn from the global COVID-19 response? We're asking people to list 3 words that describe what worked well during COVID-19. We've given you 3 ways in which you can engage for those online as well as here. The QR code, the link itself, and the website, menti.com, and a voting code. Hopefully made it as simple as possible, that we'll be able to visualize the results and hear from all of you what you think are those really positive lessons from the COVID-19 response. But with that, I want to go ahead and introduce our wonderful panelist, one who ran just from another event. Doesn't look like he's too winded right now, so that's very good. The people in person that we have here to my right, Professor Miguel Orion, that is coming from the Faculty of Medicine at University of Chile, and participated in our advisory board with the work. Welcome, Miguel. We also have Ricardo Leite Baptista, who is a member of Parliament in Portugal and a founder and president of Unite. Great to have you participating today. And I can see their wonderful faces on the video here. On one hand, we have Dr. Catherine Dugan, who is the CEO of the International Pharmaceutical Federation from the Netherlands. Thank you for joining here today. And last but not least, Thomas Triumph, who comes from Sanofi Pasteur, is Executive Vice President, coming to us from France. So those are virtual. Thank you for joining today. And maybe to start off the conversation, I will point this to all our esteemed panelists, the same question that people are answering here. What can we positively learn from the global COVID-19 response? Miguel, you want to get us started?
Sure. Hello. Well, thank you very much, David. It's truly a pleasure to be here. I must start by saying when in June, I got an email from the Economist Intelligence Unit to discuss about COVID-19. I was intrigued. I didn't know what I knew. I read a lot of The Economist, but I didn't know what this intelligence unit was and what this was about. But it actually came to be a fabulous opportunity to be able to work with first the tremendous analyst that this group has in bringing together good research over what was available to come up with a reasonable set of recommendations, but then bring together a list of individuals from different backgrounds. I think I was the only, or we were one or two physicians to think about what we had learned in our countries with COVID, the good and the bad, and bring that and give our insights to this toolkit. And I think that the main lessons have been very well said during this conference, and it basically covers the whole conference. We need to be better prepared for next time, and we can talk about that. There needs to be a global commitment against this. It cannot be one country alone. Of course, the people in charge of those countries need to believe in that this is a real pandemic to start with, and that you need to deal with it, because even that has been an issue, and that dealing takes a lot of collaboration, There's no one solution, and you need to come up with many, many different aspects that need to be dealt with. And that is, to end this part, the beauty of this toolkit. I think what it builds in is all the aspects that could be thought by a wide community of individuals that should be considered. So if somebody comes out of the blue, doesn't know much of how to manage a pandemic, here are a list of the factors that you need to consider from medical, from healthcare perspective, from social perspective, and others that you need to think upon in your reality of your country with what you're dealing with, but you need to look at these issues to better deal with the pandemic.
Wonderful, thank you, Miguel. Ricardo, the same question to you, that one lesson that sticks in your mind in terms of what we've learned from the COVID-19 response. Hopefully we can find one positive one. There's challenges, one we don't want to ignore, but that one positive lesson that you think is important to help shape today's conversation.
Well, thank you, David, and it's a great pleasure to be with all of you here today. And I must say that I find the toolkit to be of extreme use, even for not only for our discussion, but moving forward. We must learn from what has happened, as you mentioned, and I think an independent assessment of what went well and what didn't go so well is of critical importance. I have this terrible sense, just to give you some background, I'm a member of parliament. I'm the founder of Unite, which is a global network of parliamentarians to end infectious diseases, but I'm a trained physician in infectious disease. So being in parliament as a trained physician in infectious diseases at this moment in time, you can see what I've been going through. And dealing with sometimes seeing the way we dealt with COVID-19 in certain contexts, especially because of Unite, we have this global view. One can see that in many responses, we ended up responding the same way we did to the Spanish flu in 1918. Mm-hmm. And we must make sure, and I feel this as a weight on my shoulder, as many of the scientific and political community should feel also, that 100 years from now, people cannot look back and say, they left it the same and we're dealing with it the same. And so that's why I feel that this toolkit and this discussion is so important. I can give one positive example of something that went very well coming from Portugal, which is on the vaccination front. Portugal is right now the leader in the world in terms of vaccination coverage for COVID-19. We're around 86% total population coverage. And to respond to why we got to that point or how we got to that point, we must look at some of the different details behind it. First of all, there was a cultural aspect. And that's something you cannot change from one day to the next. It's 30, 40 years of public health work developed by public health authorities that have invested tremendously on creating a trust mechanism between the citizens and the health authorities, and making sure that messaging was very clear on the importance of vaccination. And this goes to show that when, you know, push comes to shove, you need to have that underlying work to make sure that then in crisis mode, that cultural background or foundation is there to make sure that you're able to move forward. And that I would say is critical. And in Portugal, just to give you an idea, you know, in prenatal care, pregnant women are already introduced into the importance of vaccination. Vaccination is not mandatory, but when kids are put into schools, if the parents decide not to vaccinate their children, the school has the mandatory obligation to inform primary healthcare services that that family decided not to vaccinate the children. And then the family is called in for an education process so they understand the risks of their decisions. And so at the end of the day, people tend to understand very clearly and see their questions responded to. But then there are other aspects that were of great importance. As a member of the opposition in Parliament, our speech, when it came to essential matters like vaccination, the messaging was clear and coinciding with the government. And we are the main opposition party. But when it comes to public health matters, when lives are at stake, we need to cut out the political bullshit and make sure that we are focusing on what matters and making sure that the messaging is clear, because we know that false messaging, misinformation can have a detrimental effect on human lives. And the third aspect is logistics. So it didn't start out well at the beginning because the government at the time decided to make it more of a political initiative. But following our recommendation, the government decided to shift from a political leadership to a military leadership and transform logistic distribution of vaccines, which was a mass vaccination program as in many places in the world, was given to the military. It was led by a vice admiral of the Portuguese Navy, specialized in logistics. And the truth is, on the logistics side, the streaming of the whole process from reception of vaccines to getting into the arms of the people went through brilliantly. And that, I would say, are the three main reasons. And it goes to show that there's never just one person, one leader, one organization, and sometimes not even doing everything right at that moment because you have to have that background from before. And so moving forward, I think we have a lot of positive lessons to be learned, even from the negative experiences, to make sure that we're better prepared in the future.
Well, there's a lot of great themes there we're going to get into specifically, because how it happened and it came about is really very critical for others to understand both how it happened and its impact. Well, let's go ahead and see if we can engage some of our wonderful experts virtually. And Catherine, maybe the same question to you in terms of those positive lessons from COVID-19 that you reflect on at a country level and your perspective and your role that you have.
Thank you so much, David. A real pleasure to be here with you today. And I must just echo some of the feedback that you got from the other panelists who were there with you in the room. What a great experience this has been, offering different perspectives and different approaches and all of our reflections. I think the toolkit is a huge success, and I know it isn't a static document or something that is on ice. I am the CEO of a global federation, International Pharmaceutical Federation, and that federation represents about 150 member organizations across all 6 WHO regions, with about 4 million pharmacists, pharmaceutical scientists, and pharmacy educators. So I didn't contribute to a single country viewpoint. I was able to provide a few little insights that I think build on what some of our previous speakers have said. Successes. So from a pharmacy perspective, staying open and building on the strengths of being accessible in your community or within the hospital sector, but particularly in communities where most other services closed, was a huge success. And I think that builds very much on the comments we've had previously about infrastructure that is there already. You have to build on what you have, no matter what country you're in. The second idea of success is collaborations. You don't you don't put the politics first, as we've heard, you put the endpoint first, and that includes public-private partnerships, that includes paymasters, that includes sharing the evidence base and the approach to vaccinations. And something I think, just as a moment of reflection here, as we go through this, it isn't like it's all done at one point. It's a multi-phasic approach is needed. You need to take constant situational analysis and then build on that and deploy the resources that are there and needed at that time. And that would require, I would say, as a learning for all governments, to look at the health professions you have, look at the collaborations you have, and look at the expertise that you have in every community, in every high street, and in every point of access of care, and mobilize them by freeing up regulations, ensuring safe supplies, ensuring the right personnel can help with the testing, the diagnostics, and then with the vaccination solution. Those are some of the positives we've seen, but you're quite right to say that no one country has got it right all the time. That's why you need your situational analysis. I know there's more to say, really, but I think that's the big thing. And actually, from our perspective in pharmacy, making sure that we have equity of access, especially to those who may be frailer, older, perhaps from lower socioeconomic status, or with access problems themselves. Thank you.
Perfect. Well, you got into a lot of those themes there, stakeholder and collaboration. I'm also glad that you mentioned a really important point that this is an ongoing process. And we need to celebrate by having more evidence and be able to act upon that. Let me go ahead and engage here, Thomas, and thank you, Thomas, for joining us here today. Any thoughts about those positive lessons from COVID-19 and the response that you see that you'd like to highlight for today's audience?
Absolutely, David. And first of all, let me say that I'm very pleased that Sanofi actually has supported the development of the toolkit, which is, I believe, a very comprehensive report that has been developed with you at the Economist Impact, but with all the knowledgeable experts, because you mentioned up to 10 or 12 knowledgeable experts have influenced and put their signature on this document, which will be very important moving forward. So on the lessons learned, there are so many, so I'll try to highlight just a couple of them. Some of them have already been mentioned. On the positive lessons, first one I would say is collaboration. Collaboration is possible and works well when it's done without any political thoughts, without any other goals but the actual end goal. And we heard about the example of Portugal. There are many other examples that will show that collaboration is key. Second positive aspect I would say is planning. Planning was not always perfect, but when there was planning, it makes a big difference. I think that's one of the key lessons learned we'll have moving forward. Planning matters. And the third one, and I have a little bit of a personal bias on this, of course, as I'm heading a vaccines company, I will say investment in health and investment in vaccines in particular shall no more seen as an expense, but really as an investment. There is nothing in my view that is second to health. And therefore, I think that this COVID-19 pandemic has shown that investing early into vaccine throughput is absolutely critical to move forward and be ready for the next pandemic.
Well, thank you, Thomas, for that. And certainly, again, some of those themes and examples we're going to dive into starting right now. And I'm going to go back to Ricardo and see if we can do a bit more on this government unity side. You can imagine countries around the world had a bit of the opposite experience. Some well-known, some very voracious in the press, that ultimately had a very negative impact on people and population health response. And walk through that process and making that happen, that unity process, the decision-making process, how that was able to come about, and what made, in your situation, a bit unique, where people were able to come together, where others actually used it as a point of divergence.
It's a difficult question because I have a hard time identifying a mechanism through which we can make future threats politically safe in a way, or create some kind of political proof mechanism through which we can make sure that every time politics and policy is science-led and science-based. What happened in Portugal was an alignment of circumstances, basically, because we had a government, as in many governments, that had to deal with the issue. And on the other side, the main opposition party, there was a leader, the president of my party, who said from the start, this is not a political issue. And I became the spokesperson as an ID trained doctor, also in parliament, and spokesperson for health of the Social Democratic Party, who was aligned with my party leader. And we became the leading voices in that situation. And then we, in some way conditioned and framed the narrative moving forward, even for other smaller political parties in parliament. And that, of course, created the momentum for the mood in civil society. I recall on March 13th, 2020, the government was about to make very, very harsh decisions. You know, we're talking about the first big lockdown. And because nobody really knew exactly how to deal with the situation. And I delivered a speech that became viral at the time, calling on people to cancel everything and stay at home. And the idea was, you know, we need to regroup, we need to save lives, and we need to make sure that we implement the managerial structures that are needed in terms of pandemic preparedness and response that are not there. And at that point, there was no advantage politically, especially in terms of the lives that were at risk, to expose those weaknesses, if we will, in terms of management and government. The importance there was to make sure that we got the job done. And that's the important alignment that happened. In many contexts around the world, I would say that possibly due to the lack of understanding of the severity of the situation, political leaderships took a bit longer to understand that this was not politics as usual. This really needed political unity. And so in hindsight, I guess what we can say is that awareness, preparedness of our political leaders to deal with, in this case, biological threats, is of critical importance to make sure that when the time comes, we are capable of finding those bridges to make sure that we don't let politics get in the way of science.
Yeah, and those foundational pieces are really very critical. And as one of the questions we'd like to, how can you count on the government to implement policies that go beyond the next elections? And part of the foundational pieces are really very critical. Before we get into the Chile experience, because I think there's some interesting lessons from that, particularly when you look at the intersection of policy and the COVID response. Did that national response translate into the local engagement? One of the things that we've heard here is about that local engagement, so it's not just happening at a national level, but that consistency in the communication at a local level. Was that something that happened as smoothly? Was it somewhat inconsistent? Talk about that local level response and how that did or did not adopt kind of that national unity from a communication perspective.
I would say it was quite asymmetrical, so to say, because we did see local leaders, and once again, leadership is so important. Local mayors picking up the baton and really pushing forward the agenda from, you know, right out of the gate, looking at international examples, who's doing what, where, how, mobilizing local resources. But what we saw was in municipalities, in cities where local leadership was strong and timely, and, you know, in my city, which is Cascais, 20 kilometers from Lisbon, the mayor called many people, myself included, where, you know, kind of a task force to advise the mayor, and everything that was put on the table, you know, we're dealing with novelty. What do you believe needs to be done? The government was giving some recommendations, but then you need to translate that. What does that mean really on the ground, right? In real life. And so I remember at the time, no masks were available. They imported a machine to make 1 million masks a month for the city, and they made them accessible to the full population. And these are, you know, testing was made fully available for free across the municipality. But if you go to other cities, you didn't see those kind of response, or even on the social front or on the economic front, creating, you know, food programs, financial incentives to help those most in need, businesses that all of a sudden closed down, to make sure that you know, the city was capable of not just surviving, but capable of having the resilience needed for when the pandemic were to end, we still existed with perspectives of growth from an economic perspective. And so having that broader vision, it was very dependent on that kind of leadership, because I don't think we were truly prepared. We didn't have a toolkit at the time on how to deal with such a situation. But I have no doubt that local government is the new central government. Mayors are really running the world, and they have to have the capacity building within their teams to be able to respond to such crises, including biological threats.
Yeah, and it's a really important point that I know the toolkit Miguel and Catherine calls out very clearly, in separating out the national, local entities and their collaboration is very critical. Miguel, the case of Chile and elements of the vaccine rollout and support mechanisms, certainly with the Latin American context, probably with an broader emerging market, is certainly seen as success. But there were obviously challenges going on in Chile. You had to work on a new constitution. You had a broader social revolution that was in process and is still in process. Talk about the dynamics within Chile and some of those things that worked well, that despite the ups and downs and that movement, that social revolution, that things like the vaccines rolled out very well, particularly compared to the Latin American colleagues.
Yeah, well, it was an amazing challenge. Just so nobody gets nervous, I have an allergy. I don't have any virus. I'm COVID-19 negative and fully vaccinated. So, but the challenge in Chile was huge, as in many countries, I'm sure, around the world. We all have our problems, but you all may know that Chile was coming out, or no, we're still in a very unstable social period at the moment. And I must start by disclaiming that I'm in academics. I have my political position, but clearly it doesn't relate anything with the government or opposition. And within this context, I would say that the strengths of the dealing of, and I talk about the Chilean community, not just the government, with COVID, I think has several strongholds. The first one is that the government did call on the experts to help them. So they created a national task force to advise the health ministry, about 6 reputable individuals from epidemiology, infectious diseases, and others to give advice. Not that they listen always to the advice, but initially that sort of created some support to a government that had a very, very low popularity rate at the time. The second, I would say, was a very strong leadership of the health minister at the time, who focused very strongly on one primary focus, which was increasing ICU beds, because we lived the pandemic a couple of months after the European experience. It was very clear that that was one of the big issues related with COVID-19. And they worked very hard on building public-private partnerships to provide sufficient ICU beds projected during the worst of the pandemic. The third, there was what I would say, a pretty strong commitment between the science community, not just in these committees, but the universities, starting to gather knowledge on the epidemics curve. And there was a huge collaboration between basic laboratories in Chile. Chile is a developing country, remember, so we're far from Europe still, but there was a huge collaboration between university laboratories, private laboratories, and others to build the PCR testing capacity from a couple of thousand tests per day to about 80,000 tests per day, which for a 20 million population country is very high. So we're able to increase testing capacity to know what our reality was with the pandemic. We were able to increase ICU capacity to be prepared to not have the last bed dilemma, which was discussed permanently throughout the first wave of the pandemic. There was collaboration with the academic groups. There was a plan, clearly a plan, and then the whole plan started closing universities, closing schools, and so forth. That was all on the upside. I think that you always have to find the downside, and the downside, the one thing that was not done in the correct way, and it's in the toolkit, was enough interaction between the central government and the local governments. So that created miscommunications, that created anxiety, it created also fights, and that's not good during a pandemic. When you start having the municipal leader saying that he was just told yesterday that they had to close, but he wasn't participating and so forth. And that created a lot of problems. And that was relatively solved during the months when the government created a social table for COVID-19 management, bringing in leaders of the different parts of the community to convey almost on a day-to-day basis what they were doing. So I think there are many other issues, but I think those were key elements. And the last one actually is that the government, and this I must take credit to the president. He has good and bad things, but one good thing, his vision as an entrepreneur is that vaccines are going to be important critically. So he created a task force to look at vaccines that were being developed. We're talking June last year. So they were just in phase 1 trials, an advisory committee to look at the vaccines that were probably going to make it for October, November, so that a tri-ministry committee could relate to those companies and start engaging to try to get vaccine procurement. Of course, we know today that that's not great because it's sort of a one-to-one basis, one country with producers who would like more COVAX and those systems, but well, countries and presidents think they need to take care of their people. And that allowed us to have, actually, compared to, I think, the rest of the continent, vaccine procurement that has allowed reach the high levels of vaccination that we have today.
Yeah, and part of those things that you're talking about, there's anticipating the issues, maybe leveraging the lessons from countries that are farther ahead in the ICU beds and seeing what's coming and knowing that those logistics, the purchasing, the needs is not going to happen overnight.
Absolutely.
Which seems very critical. And this is where I want to bring in maybe the answers to our questions in the poll before we kind of get into the different stakeholder perspective, engage Thomas and Catherine on this. What we see is a word cloud here, and hopefully those that are online can see that. And solidarity ranks very high, collaboration, science, good to see that, particularly with this group of experts that we have here, and many other themes. And you see other ones that are important, like vaccines and prevention, enhanced preparedness, that are critical, but maybe less important. But that solidarity, science, and collaboration really seem to jump out, which are hard things to codify. And one of the things I'm hearing from both of you is those foundational relationships, for good or for bad, get established not overnight, to build over time. You may have mechanisms in moments of emergency, if it's climate related, if it's related to health, or whatever it's related to. But those relationships need to be established as much as the relationships and understanding of science, the concept of medicine. Let's get into the stakeholder perspective. And I'd like to engage Thomas on this, that obviously industry has played an enormous role. The piece that you hear is around vaccines, but I think it's much more complex than that. It'd be great to hear about those lessons, particularly from industry and the real world collaborations in data and engagement, level of trust, and understanding the importance of industry in those innovations. When you think of vaccines, really didn't occur before the pandemic. Thomas, if you can kind of address a little bit of that stakeholder perspective from industry, that would be great.
Absolutely. So we all know that this crisis has demonstrated that strong collaboration across industry, academia, governments, civil society even, was absolutely key to the rapid development, manufacturing, and the delivery of medicines or vaccines at the right scale and speed in the pandemic timeframe. So I really believe that collaboration is at the heart of it. So if that's fine with you, I'd like to drive you to 3 examples of what I believe are strong collaboration. Number 1 is unprecedented partnerships to drive the vaccines development and production. In the report, out of the 8 mechanisms that you had highlighted at the beginning, David, there's one which is called optimizing resources used to make the most of what you have, which basically means pooling capacity of resources across public, private sector, anywhere, to maximize the capacity of response to a pandemic. And here, for example, if you look at development of vaccines, for example, Sanofi we set up very early on a very unprecedented partnership with GSK, which is one of our main competitors all year long for the past decades, to make sure that we were developing together a recombinant adjuvanted COVID-19 vaccines. They had at that time an adjuvant ready, which was already licensed. We had a protein platform that was already licensed. How do we combine forces to move together and go faster at development without thinking about the classical rules of competition and going fast? A second example here on this unprecedented level of partnership is about manufacturing. Sanofi is engaged today in the manufacturing of 3 different other vaccines, the vaccines from J&J, Moderna, and BioNTech. While we are developing our own vaccines, we believe it was up for us to raise to the plate and make sure that if we have capacity that we can make available, we make it available. So it's not in one country, it's 3 different countries, but we're going to be able to provide in the coming few weeks 500 million doses of vaccines from both 3 different manufacturers that are not from my group. So it's an example of very unprecedented partnership, which shows that the industry can step up to the plate when required. A very different example from that is the reinforcement in terms of collaboration of public-private partnership in order to establish what I would call pandemic preparedness infrastructure. So this has been also highlighted in the toolkit. And of course, one of the main famous examples of that is the US BARDA agency, established, if I recall correctly, about 2006, and is putting together a very significant basis to make sure that development and production of vaccines, diagnostics, or treatments can be established very quickly in pandemic timeframe. So that was a very important mechanism. And of course, the Operation Warp Speed as an illustration was there to highlight and amplify that in the US to make sure that all those either vaccines or treatments or diagnostics could be made available for the world. And that's a US example, but same thing, you can look at another way to deal with it is in Europe. While there was no end-to-end, I would say, structure existing exactly similar to the US BARDA agency, you had the fact that the EU Commission really also stepped up to the plate, managed to coordinate several aspects of the crisis, especially, for example, if you look at the supply of vaccines or therapeutic, setting up advanced purchase agreements, which with many manufacturers, including Sanofi, that was something new in Europe, showing a really tangible sign of mindset shift and really looking at investment sharing, pandemic preparedness, and that's something I think which is very positive in terms of collaboration. And the last collaboration I would like to highlight is more the public-private collaboration around data sharing. You know, we all have to work together to make sure that we're all looking at strong, robust, data-driven platforms to make the right decisions. So there's plenty of examples of that have happened. There's never been as much data sharing than in this pandemic. It's something to keep in mind for the future. And as an example, we are building what we call the COVID Hive partnership. You know that we are a very strong manufacturer of influenza vaccines. We had established a platform that was made for influenza vaccine, looking at the real-world effectiveness of those. We pivoted it with our partners to make sure that we can look at the effectiveness in the real world of COVID-19 vaccines and share that real life with all the different partners. So 3 examples of very different partnership that we wouldn't do maybe in a normal time, I would say, in non-pandemic times. But I think those are good examples of the proof that partnerships are feasible and can really deliver tangible value for pandemic handling.
Yeah, so beyond that feasibility, showing the world of what's possible and those new models that maybe before COVID really hadn't been considered or seemed more difficult or sticky to engage. Is there any reflection, constructive otherwise, that industry learned that you apply moving forward that maybe was a lesson learned that you didn't capture early on, that you want to think about for future evolutions, pandemic or elsewhere?
Well, at the level of Sanofi, for example, it will mean thinking broader. I think we used to think with a certain level of set stakeholders, if you wish. We have to think about the broader ecosystem. Of course, we used to work with different elements of the system, academia, regulatory agencies, key universities, as well as different epidemiologist agencies, recommending agencies. But I think we need to think broader. We also need to involve the society, civil societies, lay public communications. And I think we need to broaden our mindset in terms of partnership capabilities and really see it through a new lens after COVID-19.
Well, you've given us a nice segue here to my question to Catherine. And the question there is really the pharmacist and the role that they play in this ecosystem, both in delivering quality care and engagement with communities is so critical. And so, Catherine, maybe you can kind of take that perspective. You started already in kind of your introductory remarks and kind of the pharmacist perspective, but the role and everything around the COVID response and where the pharmacy, or maybe others have learned the importance of the pharmacist and the pharmacy role in broader healthcare and pandemic response.
Thank you so much. I'm going to use a couple of the key themes, the mechanisms, as a bit of an anchor for my response to this. The first one is coordination. Now, around January last year, we were all monitoring the emergence of COVID-19. And it was important for us as an international organisation not to duplicate what our national organisations were doing, but also that all of us kind of put our shoulders behind the wheel to support the pharmacists on the ground. And what we saw was just a changing need for information the whole time. So immediately, David, it's up to us as a global organisation to make sure that all that information could come in from all the different countries who were at different phases in the response to the pandemic, northern and southern hemispheres notwithstanding, and to make that open access immediately, and to make all our events open access, so that there was a really big, I think it builds on Thomas's reflection that it's not about the endpoint here, it's about the here and now. So that coordination meant there wasn't duplication, and it meant there wasn't competition between us and our national organisations or the individuals. The next one is the building trust with the public. And I really think that going forward, it builds on a point I mentioned in my introductory remarks, that you need to use what is working already in the communities. And I think that was a really good insight earlier on. You build a lot of this public health or this access to trusted professions. Remember that community pharmacists remained open, and they were very often not remembered in the first phase of the pandemic by any health ministry. Health workers or healthcare professionals are doctors and nurses and everyone else. And pharmacy is the third largest profession, so that's a little bit ironic. But they invested with no thought of return on investment in their infrastructure, in their PPE, and in actually going back to basics and making hand sanitizers for their communities. And also they employ from the communities they work in. So they had that very clear golden thread between perhaps some of the families in those communities that were so super stressed, with parents being in care homes that were locked down, or other family members being inaccessible. And remember, at the very beginning of the pandemic, day by day by day, we had different information coming out. So it's really important for organisations like FIP and our counterparts with other health professions to be providing a trusted source of evidence and the changing evidence base, and making that accessible to every pharmacist everywhere. The other one was learning from each other. And we had colleagues in the UK who wanted to learn from Italy, who so unfortunately seemed to be slightly ahead of the curve in terms of, the terrible tsunami that was to follow. And us being able to offer access to advice and expertise was really important. My final point in this section is that we didn't need the enforcement of regulations in our profession. Many of our countries needed to learn the lessons that we could provide through toolkits and through evidence-based case management of how could pharmacists become involved in vaccinations? How could you perhaps relax regulations during COVID to enable that to happen with appropriate upskilling and training and just additional bits of information. And that really opened up the access when the vaccines came in. But let's not forget that, we still see an awful lot of questions emerging, vaccine hesitancy, the facts versus the myths debate going on. And how can you mobilize that workforce that's based in every community to make sure that that is the best, highest quality information possible, and they can tap into patients and the public. And for me, I think in pharmacy, we really had to present to the health ministers that we're part of that healthcare team, even if there's a mixed funding model, if they're part of the health service or if they are contractors to the health service. That, I think, brings what Thomas was saying about the public-private partnership piece into clear focus. and not forgetting that the pharmacists were, I think it's a really interesting thing that pharmacy and pharmacists are based in every single sector, from the drug discovery to the drug delivery, to the access, to the supply, and to the safe management of it. That's a couple of nuggets, but absolutely aligned to the key mechanisms. If I may say, I think we're going to be using this toolkit for our profession, which is super.
Yeah, and again, being able to break out those stakeholders and those groups that play such an enormous role in that connection with community that outlives a pandemic, and how important that is. And it gets into issues that are much bigger within health and society, can get into equity and the like. That is so very critical, but recognizing the pharmacists, the nurses, is all those people that are in that, and making sure they're integrated, the opportunity to learn from each other, to be able to do that and anticipate what may be coming, which is really very critical. Let's go ahead and put up our next poll question, if we can, as we kind of pivot from a good reflection on the lessons from different environments. And here is our next poll question: rank your priorities for improving pandemic response in your country. Again, the links and the codes are a little bit different, but hopefully people are able to log on, see people here in person, being able to use their phones, which is great. And identifying those the priority settings are really key piece that I certainly see from the toolkit. And I want to be able to engage our panelists as we wait for the kind of answers, and seeing from the audience, virtual and here, to those priority sessions in terms of identifying those priorities. And those priorities can be specific about the ongoing pandemic, because it is ongoing. We've heard some people that were closer to the beginning to the end, which is really difficult to hear, but maybe the reality. The second piece is this is not going to be a one-time event. The third piece is the connection with the broader health and society, the lag effect, and be able to give people their treatment. That is going to have that third wave of pandemic that's going to occur for people that haven't gotten treatment, and then more importantly, just have broader, more efficient health system. So how do we set those priorities? Ricardo, you want to start when you reflect of the lessons, and how do you start to systematize them for the next pandemic, and then thinking more broadly, as Thomas talked about, how these things are all intertwined? How do you set those priorities? How do you make those choices?
Well, I think that systematizing what we need to do is of critical importance, and that's why such a toolkit is so useful. And of course, as always, we need leaders that are willing to do so. But even leaders that are willing, they need those toolkits to move forward. Another aspect alongside with that, I think, is the importance of independent assessment of what happened, which is something that is nobody is really comfortable looking at their faults, but this is not the idea here. And that's where where it gets politically sensitive. The idea here is not to have a political assessment, but it's having an honest discussion from a scientific angle, if we will. What could have we done differently and better? That independent assessment, as you know, anyone who managed from a university department to a business understands that having an independent and external assessment of what we are doing is of critical importance. And understanding that then it varies from country to country what we need to fix. But the first thing is valuing what went well. And so making sure that we continue to invest on what we're doing well. And then understanding what needs really to be adjusted or perfected. And that goes across the board, you know. And I think it was very well outlined throughout the toolkit what those different areas are. You know, from the top of my mind, data collection, analysis, the analytics of data is of critical importance. Communication, I think now it is very clear, as Miguel was saying, between different levels of government, but also between those levels of government and the people, and having capability to communicate better, to stratify the way we communicate to different social segments, to different population segments, to understand that we need to use social sciences, that we need to use behavioral economics, to understand that we need to use a multidisciplinary approach in nudging behaviors, in making sure that our messaging is getting on through. being able to develop trust in science. And that is something that, as I mentioned right at the beginning with the vaccine example in Portugal, is something that is built over years. And so it's something that we cannot wait for a crisis to happen to invest in. It's something that needs to be implemented through these communication strategies ongoing. And of course, then, you know, all of the new tools that we have in terms of surveillance, syndromic surveillance, genomic surveillance, making sure that we're top of our game. All of these issues are of critical importance. And I think that it is very clear now that at a national level, and that's what I'm focusing on in this response, we also need to make sure that we are capable of having mechanisms or even formal institutions that are better prepared to respond to biological threats, be them of natural order, such as a pandemic, or of terrorist origin, for example. But our capability to have mechanisms or institutions that bring together the health sector, the military sector, the civil protection center, the different facets of government that need to respond when the time comes, to being prepared to simulate different scenarios on an ongoing basis to make sure that we are ready to respond when the time comes. And that is something that clearly exists in the military area, but it's something that in health emergency response, the further we've gotten to, in most cases, is preparing a booklet that's on a shelf somewhere that says who does what and where. But we don't have real world simulations for those kind of scenarios. And I think COVID-19 has shown, this is something that many people were calling for following Ebola. The fact that, we were lucky this time, let's make sure we're not caught 5 years later. 5 years later, we were exactly where we were before. And then we can talk more further on the international collaboration and on the role that we need to discuss at that level. But even at the national level, I feel that we still have a long way to go to make sure that in the case of a new pandemic, which is in a globalized world is more than probable, that we are better prepared.
Yeah, and certainly taking advantage of those real world lessons that feel human. The case of some of the Eastern Asian countries that have experienced a decade before, that were embedded about the worries and concerns, and the response, particularly from the population and those that are in charge, were much more specific and much more acting. Miguel, how do we, particularly in such a fluid environment, and we reflect on Chile, and Chile is an example of many countries that have, the world doesn't stop necessarily because of the pandemic, the needs of the population, the movement, social, otherwise, the needs and the health perspective don't stop. How do you find that balance in setting priorities? And particularly, we think about the environment of public health in schools and the ability to keep children in schools versus doing it in a remote environment that also has negative impact. How do you find that balance in terms of impact as well as priorities, particularly when you're learning as you go along? And sometimes when you shift course because you have more information, those in the opposition will see that as an opportunity of weakness. Actuality, it's actually a strength that you have more information. How do you set those priorities?
It's tough. First, I want to say I'm a little bit envious of Portugal of having politicians that have such a solid view. Maybe it's because you're infectious disease. Actually, I don't see such a level of profound discussion sometimes, and I would like to see them more in our parliaments because it's critical. Setting priorities is you need data. I think that is critical. And one thing that was missing in this pandemic, and missing more in some countries than other, that was having a real grasp on what was happening with the pandemic in terms of cases, hospitalizations, deaths. There was a huge discussion, how many people were dying where, ICU beds, then the virus diversity, the variants, and clearly some countries were doing better than others. And I think that one thing we learned is, if possible, bring research quickly into this, bring the scientific community to generate data for your region, your country, so you can have better decisions and know what's going on. If you don't know what's going on, it's very difficult to really know what your priorities are. So that's, I think, very important. Our Ministry of Science did a great job. We have a new Ministry of Science just generated about 3 or 4 years, and they put a lot of effort in building up data, bringing the scientific community and said, help us with whatever you can. The engineers work a lot of modeling on ICU beds, hospital beds, where the pandemic was going based on the cases this week. And they could really model how things were going on. So you could set the priority there for the healthcare. So I think that's one critical thing. You need to generate data in your countries the best you can. You need to do research and you need to know your reality. Of course, you know, Chile, Brazil, the US, Portugal, Uganda, all will be starting at a different set point in this pandemic. And you need to know what your set point is to match it with the toolkit and say, okay, we have about 8 or 10 of the 20 points relatively well covered, but the other 10 that we're still missing. And some will have 2 or 3 and at different levels. So that's why I would say this toolkit is helpful. And you finally will set your priority based on what you know your reality is. And it can vary, you know, if you're a country where you have a lot of issues because you don't have hospital beds or ICU beds, then that's a priority in a disease that's killing people, you know, and you need those. But that was a problem in Chile. It wasn't such a problem in Argentina because they have a public system where they have a significant amount of ICU beds. So they were not at risk of overflow so massively as we were, because we have more a private system, the private public, but not such a strong public system. So each country needs to know what their reality is to set those priorities. And I think clearly for the next pandemic, we need to rapidly get a grasp at what are the issues related with that pandemic? What are the age groups that are being affected? And how is it affecting? And then you know where you need to act. Get data on the evolution of the pandemic, and then use a toolkit like this to look at all the aspects that you need to really be on your knees, on your toes, actually, not on your knees, on your toes, that you need to be looking at. So none of them fall short. We haven't even talked about the social and economic aspects that were critical to be able to allow that the unrest related with sending everybody home and not working would be feasible for months and months. So that's a whole aspect that if you don't look at it, at the same time you're looking at hospital beds, you're looking at diagnostics, you're looking at vaccines, your table is going to be really, you know, falling down because it has a leg that's not working. So there's so many things that you need to look at, that you need to know your reality and see which of those you really need to strengthen.
Well, that connective tissue, as we were talking about the national, local level, is equally important across different elements of government. Chile, I know, has a case on top of aging that doesn't include just the ministers of health. It includes other elements of society because it's a labor issue, it's a social issue. And to have those working together, coming together, looking at these issues holistically and thinking what are the levers that really matter in moments of crisis, those are really very critical. Thomas and Catherine, I want to get into that. And Thomas, you and I were talking about this last week about how do we make these type of collaborations sticky? How do we make sure they continue, are not just a series of one-off that tail off as the environment changes, that our response mechanism for the common good, for the necessity, for the right thing to do is one thing, but these collaborations seem to have a lot of benefits for industry participants, for other elements of society, the government and academia, and the examples that have been brought up here. What do we need to do to enable these type of collaborations, and the ones we haven't even considered, that may solve a lot of these issues and preparedness in ways we haven't thought about, to make sure they're sticky for the future?
That's a core question indeed. Sustainability of some of those collaboration and partnerships will be critical to get ready for the next pandemic. So building on what was said before, that we need to start from the positive to get to the greater good. I believe indeed all stakeholders across the ecosystem have raised their bar during this pandemic by working differently, adapting healthcare systems, reallocating resources, adapting radical medical countermeasures. fastening the regulatory approvals, sharing data as we discussed. Now the question is indeed, as you're mentioning, David, how can we do more and more sustainable? So I believe for that, and there's no question about why. Why now? I think the case has been pretty much well established. Everybody knows why. So a couple of things I think in terms of collaboration we should consider in terms of more sustainably. First point is about what I call the collaborative structure, end-to-end pandemic preparedness. I talked before about BARDA. We know that tomorrow the Health Emergency Preparedness and Response Authority, HERA, in Europe, will be another framework that will be looking at how do we facilitate the next pandemic response, making sure we increase the level of preparedness in Europe, for Europe, but also for the rest of the world. Let's make sure beyond US agency BARDA and HERA Europe that similar structures in the future are created in other regions of the world. It's very difficult. Nobody has the financial means pretty much to do that at a national level. But how can we establish other trans-country or regional such agencies moving forward would be very important. Second point about data surveillance, epidemiological collaboration. There's a lot we can still do in terms of increasing the level of surveillance systems, making sure increasing the level of digitalization, of our health systems, and making sure that we improve and increase sustainably the data sharing. There's work that has been done on that. It requires a little bit of courage, a little bit of investment in the first place in terms of digitalization, a little bit of courage to establish the right framework for sharing and cross collaboration. But once in place, it's invaluable. You identify much quicker the next pandemic, you know more, you react quicker, you put the resources where they are needed. And third point is probably, as I was alluded to before, better and more regularly engage with social media, with community leaders, in order to make sure that we share evidence-based information to build trust and confidence. It's not something where the industry has been most comfortable doing in the past, but I think that the world of tomorrow and the next decade is not the world where it used to be. So let's make sure that we develop, not in silo, but in collaboration with others, avenues by which we can share evidence-based data, because we know very well that no corners have been cut in the development of vaccines or therapeutic, that the same number of people have been put in phase 3 trial as there is when it's a 5-year or 10-year development. But very little of that sometimes has been shared in the right manner. So let's think about this collaboration ahead of time, because if you build them during the pandemic, there's a matter of credibility there. So let's make sure we build them upfront. A practical example on the latter one. We've just created hashtag Team Vaccines. That's a really industry's first global digital campaign that's showing basically personal stories from the people that work in the vaccines or in the therapeutic companies, that explains why they're putting their heart, their mind, and why there is no other way they will develop a therapeutic or a vaccine than if it was to be administered to their own child or parent. And I think that having more communication tools like that, channels, engaging more regularly will be very important moving forward.
Yeah, you bring up a really good point there, because in the absence of that communication, there is a downside of misinformation that will occur through those channels, if we like it or not. And I think people, particularly as they learn about topics and terms like efficacy, and really have a better understanding, literacy of what that may mean, you can shape that in the positive way, or it can revert back to the norm. And recognizing that's how people get their information, and generating that level of trust. People not most often are looking for those trusted sources, but in the absence, they're only left with the ones that communicate through those channels. So I think that's really very critical.
And these, if you allow me, sorry, David, these elements can be implemented at the country level. But I do believe, and of course, we know that the toolkit is for country preparedness. So that's the camp one we wanted to reach today. But I do believe that on top of that very fundamental pandemic preparedness role of countries also have an important contribution when it comes to the global agenda. And for this, I'd like to highlight a couple of things that are important to sustain moving forward. The number one thing is the immediate sharing of pathogens with either pandemic or epidemic potential and their associated genetic sequence. We know that there is the very famous so-called Nagoya Protocol, well intended in the first place. I believe that it's very important to have a second look at it, because if the Nagoya Protocol application is something that prevents some countries to actually share in a manner very critical importance about human pathogens, I think in times of crisis, that's not responsible. So we need to relook at that. And the second part of countries having an influence of across countries at the global level is regulatory convergence. Again, if we look at every single country looking at its own regulatory science and setting up its own rules and its own bar, it's going to be very difficult to deliver access very quickly in terms of pandemic measures, be it therapeutics or vaccines. So I think regulatory convergence, having single countries saying, okay, it was a talk before, now it needs to become a reality, will be very important moving forward.
Yeah, and you bring up an important point there. I was going to go to you, Catherine, representing an international organization and the role narrowly defined or broadly defined of international organizations and that connection that's very clearly outlined in the toolkit. But there is a role there for the international organizations, either to take leadership or to be in a supporting mechanism. Talk about how important that is moving forward. So that, again, we don't revert to the norm. We continue to do things. I think your terms are not in a duplicative way, but in a complementary way, which is really very critical, because there could be perfectly good initiatives that are being done, but are actually creating a bit more of a mess and misunderstanding than actually coming together and doing it in a way that doesn't duplicate. Talk about that role of that kind of country and international organization in this whole process.
Thanks, David. I think there's some really good words there that I'm going to use, including sustainability and crisis and iceberg. And I'm not sure that they all necessarily fit together naturally, but sustainability, look, everybody is really quite exhausted at whatever stage they find themselves in. It's been a long haul to date. And there's a real worry, I think, in countries that particularly where pharmacists and pharmacies are able to step up and step into the roles that their communities need and their hospitals need, that once the pandemic, the crisis has passed, that maybe all that collaborative endeavour and that added value that has been brought to bear will be lost. And we mustn't do that, because you mentioned about the join up that you can get from an international federation. I'll give you one example, David, and that was, we had already brought together a lot of regulators in pharmacy to create like a regulators forum prior to the pandemic, looking at issues like shortages and supply chains and safety of medicines, which were prior to the pandemic a massive issue. Of course, the pandemic has just made everything that was a massive issue before into a mega issue. And that regulators forum was able to turn around a toolkit of sharing what regulatory reforms had gone on in country A with country B with country C. So exactly what Thomas is saying, can you make things more speedy by sharing? And I feel an international federation can do exactly that. It also means that countries can look at their situations. And Miguel spoke about Chile having maybe a lack of infrastructure. Other countries may have good infrastructure, but a very poor population health. And if you look at the ways in which different countries have responded, you need to mobilize your health workforce in those countries to react to the situation they see. And, you know, it also, I think, builds on Ricardo's comment about you need a long-term strategy for this. So once the pandemic is over, what are our preventative strategies and how can you mobilize health workers like pharmacists and all of the pharmacy workforce to be able to put in preventative systems, get people to be healthier, perhaps living healthier lives. So if another pandemic comes, that isn't the biggest risk factor in your population. You can't help your age, David, but you could help other factors. The other thing I think is to, and apologies, colleagues, but never waste a good crisis for learning how to do things better. And I don't mean that in a glib way, but I think as we are all exhausted and frazzled coming out of the pandemic, if you can take the nuggets that have worked and put them into common practice, building up sustainable workforces when they're feeling very, very fragile at the moment, putting into place good remuneration packages that will sustain that model of care in the community, preventing perhaps overburden on hospitals, will be key. It won't be what governments want to hear, because they're all going to be looking at their piggy banks and thinking there's not much in there. But you know what, if you don't invest now, when the next one comes, you'll be in an even worse position. And I must say that if you did that as a health minister and a finance minister and someone who'd be looking at labour and employment, and you look at that iceberg of need that is there, of people who perhaps stayed away from needing care, accessing care when they needed it during the pandemic, or people who perhaps now have exacerbated conditions like mental health needs that they didn't have before the pandemic, you're going to need to mobilise your health workforce in all countries to be able to roll their sleeves up and to effectively manage that iceberg of care that was, I suppose, in different countries that would have been at different stages of need. But in all our countries now, we know you've got a health workforce that's still dealing with the pandemic in environments where the health need is growing and growing and growing, and with strapped resources as well. So we need to really bandy together. Our role in international federations and organisations is to support our member organisations and nations by sharing good practices, by making advocacy toolkits, by doing the business cases, evidence of impact of what has been happening on the ground. How can we support the pharmacists to move from model A care to model B care? How can you mobilise the whole workforce? There's not a one size fits all. I think you used that lovely phrase of a cookie cutter. So we mustn't be prescriptive. Apologies for the pun, but we must be enabling and empowering and actually very directive. I think there is no room now for waffle and speculation. That toolkit, David, in previous years would have taken us probably 18 months to develop, because it would have had to go through all different boards and different processes. We got it done in, I think, 3 or 4 weeks, because everybody had the appetite to roll their sleeves up and make it work. And it has helped countries since. Thanks, David.
And again, it shows that the world of what's possible, right? When you're forced to do it, you have very limited options. Let's go ahead and show the results of our last poll, and then we'll get our final thoughts from our great panelists. This might be a little bit hard to read from our side, but you can see national and intentional coordination ranked at the top, making diagnosis and vaccine treatment available. Learning lessons. A lot of them seem to be quite balanced in terms of what those priorities may be, which again, we recognize particularly the virtual audience may be coming from different environments. And as Catherine was talking about very aptly, you need to focus on the things that you need, leverage your strengths and fill in those gaps where you need to follow that evolution, which is really very critical. But it's interesting to see that balance in terms of priorities. So let's take that as our last question for our great panelists here. And Ricardo, we'll start with you as you think about reflecting moving forward in the pandemic. And again, recognizing this is still ongoing in this process, and maybe taking Catherine's word of never waste a good crisis. Maybe it's better if there's a window of opportunity for seismic change and how we think and deal with the world of health. What is that top priority too for you that you're looking at? And maybe let's say kind of the flip side of concern of, I don't want to revert to the norm in topic X, all right, to make sure we don't have that level of complacency.
Well, I think that we've already discussed somewhat the importance of multiple approaches in terms of the national level. And I think that the poll has shown very clearly that everything is important. So in the opinion of everybody here and watching us at home, we need to make sure that we are capable of doing everything in parallel. And that is what needs to be done. And, speaking of Proverbs, the Chinese normally say, before an age of brilliance, there is chaos. So that gives us hope, right? And so I would say now, looking more at the international arena, there's a lot of discussion around the idea of a treaty or a legally binding mechanism that WHO is rightfully pushing for. This brings us back to following World War II. There was a clear perception by most of the world that war was bad for business in a way, or bad for the economy. And so we needed to find mechanisms for peace and prosperity. And mechanisms like NATO were created. now following the pandemic, it is very clear that the pandemic is bad for health, but it's bad for social impact. It's bad for the economy. We need to do something to make sure that we have our defenses up. Creating new mechanisms or new institutions or a NATO for health would possibly be a way, but we need to be practical and we need to work in the political framework that currently exists. And there is no appetite for more multilateral organizations. And so building on what exists at WHO with a treaty focusing on pandemic preparedness and response could be useful. My concern, though, is that we're not all on the same page globally. Different countries, important players on the diplomatic scene, think very differently than what we are saying in this session. And so this takes me to what I think should be called the three little pigs approach to pandemic preparedness and response. I have a 5-year-old boy who asks me to read that story every single night. And so maybe it's my trauma bringing into it. But the idea of the three little pigs is very simple. You all know the children's story. One pig, to protect himself from the wolf, created a house out of a straw, the second with sticks, and the third wanted to be very protective and built it out of stone or bricks and cement. And we know exactly how that story ends. But the truth is, not everyone is on the same page. Some people want to build out that straw house and others want to build up that stick house. And what I think we need to focus on is creating a coalition of the willing, of those that are actually willing to build those brick houses, to defend ourselves, to prepare ourselves, to make sure that when a next pandemic comes, we are prepared, at least in those settings. And why I'm saying this is because if we do not do that, if we always satisfy ourselves with the lowest common denominator, we'll end up all with straw houses. And what that means is that we will not be prepared again. And if we have countries and regions that are capable, and Europe has the moral obligation to take the lead on this issue. If we take the lead and we show that we can do it, bringing together those different pathways that the toolkit has set out very clearly, then this may serve as an inspiration for others feeling, I do not want to be caught in a situation where I'm not prepared. And so in a positive enforcement, so to say, we lead others to follow example. And so this is bringing together the diplomatic skills of many of those working in these multilateral organizations. But I think this is a very important discussion. And having participated in so many World Health Assemblies and understanding that we tend to, within the UN structure many times, to satisfy ourselves with the lowest denominator. It's something that concerns me deeply because I think that, as was said, we know what needs to be done. The science is extremely clear, and we have the technology, we have the tools, we have the partners willing to come together, public, private, social sectors willing to work together to make sure that we are better prepared in the future so that we do not put this hardship once again, because at the end of the day, the economic consequences, the social consequences will not be suffered by those that are rich, will not be felt by those that are in a higher social status. It is the most poor, those in most vulnerable situations that will always pay the price of our inability to react and to prepare appropriately.
Coalition of the willing.
Good speech.
I think that's certainly raising the bar here and using as an example that others can follow and even use to help justify their own decisions. Yes. Very good. Miguel, what would you add?
When I look from Latin America and I see what you guys are doing here in Europe, once again, I'm envious because you have a European Union where, things are not perfect, but you tend to act as a bloc. And I think besides Europe, we don't see there anywhere else in the world. The US is a full country, a continent in itself, but the federations basically each acted on their own. But there was not really much leadership. And what you need here is governance and leadership and collaboration. In Latin America, we're far from that. And that is a little bit of a tragedy. I'm talking about my reality because politics clearly overcomes sometimes what is collaboration. So my call there would be to, and I take your the leadership role that Europe can have here to advance for the world, because we know what we need to do now. We have the toolkit. We know the measures. I think it's pretty, but the other thing is how we're going to go ahead and move forward with that. And for that, we need collaboration, real collaboration. And maybe we have to generate a structure under presidents at a second level that can be prepared. And it's not politically motivated, it's technically motivated. Of course, WHO has a critical role, but we all know what happened with WHO and the little support it got from. We need to strengthen WHO. There's no doubt about that. They can maybe take that leadership, but I think that is a structure that we need to look for now in the future. And so take the glove, and hopefully something like that can be brought so we can implement things in a better way in the future.
Wonderful. Thank you, Miguel. Catherine, any final words here? And I'm being shown that we're conscious of time. So just maybe a 1 minute of final words for this group reflection.
I'm not always known for it, David. I promise you I'll be brief. I want to just commend the toolkit to all participants today, and we will be doing that to our profession and to all that we are in alliance with. The discussion on page 69 provides a sobering set of limitations, but the pragmatism in all of the mechanisms in the toolkit, learning from the countries that are under scrutiny, provide us with practicalities and with a vision that we can do better next time, notwithstanding some have done really well throughout it. So I just want to build on some of the things I've heard from Ricardo and Miguel. I agree. I think that we need to redefine the word consensus, and the consensus needs to be about agreement for what's needed, not what's doable and what's the lowest common denominator. I'm inspired by that, I must say, and we'll do what we can to enable and leverage our workforce across all our nations. And where we see gaps, I commit to you, colleagues, that we will make sure that the pharmacists in countries where there are gaps in provision are supported by other countries that have the products and the services and all of the experience and the evidence. We will do this, we have to. My final point for you is I love the idea that we might have a supra political agency or set of agencies that literally have to compel the governments to do this, because everyone will end up with a straw house. And to draw on another fairy tale, Goldilocks, let's not make the porridge too salty or too sweet, but let's make it just right. And let's build these houses with wheels and wings and sails so that we are ready for anything as well as being secure. I'm really empowered and enthused by the comments at the end here, David, and I thank you for your chairmanship on this. I hope that's brief enough.
It's perfectly brief, and you brought another fairy tale into this. Again, my kids will be delighted with that piece too as well. Thomas, I'm not sure if you have a fairy tale to add into your final words here, but it'd be great to hear your final thoughts around this as well.
No fairy tale here, but big thanks. I think the conclusion from my predecessor were perfect. It's in our hands. Don't let a crisis go by. It's in our hands. We have to work on it. It's a matter of collaboration. A country alone cannot do it. But if you use that as an excuse not to start using this toolkit and get ready, you're as guilty as everyone else. So it's now, it's in our hands. We all want the stone houses, not the straw houses. And there will be no excuse for the next time. Look at what has been done. After the very beginning part of the pandemic, everybody was thinking that there would be no collaboration. If you look at the positive sides, we can do it. If we just invest a bit to sustain it in the governance, in the making sure that there is access, in making sure that countries are ready, in making sure that the political will is behind the science and behind health, we will do wonder, and the world will be a very different place for the next pandemic. It's in our hands.
Well, thank you, Thomas. I'll let that be the last word. Thank you all, and those virtually participating today. I hope they take heed to the recommendations that have been set out here. Here's a link to the work. Thank you so much for today's participation, and certainly to our wonderful panelists.
Thank you.